Okay, here we go.
Welcome, everyone. We are delighted to welcome you this afternoon to our webinar on misinformation and public health, implications for personal responsibility education program grantees. We are at the top of the hour, so we're going to go ahead and get started because we have a lot to cover in 1 hour. Feel free to, in the chat, put in your name and where you're zooming in from today, if you'd like to introduce yourself to your colleagues. I'm delighted to introduce you to our speaker today, Dr. Brian Southwell, who is an expert in misinformation and communications in general. He oversees a lot of our communication work here at RTI, and recently was nominated to a National Academies of Science Committee on Understanding and Addressing Misinformation about Science. So we're really excited to learn from him today. And I also would encourage you to kind of keep an eye on the work that he and his colleagues will have coming out over time as well. So to get us started, today we're just going to go through some of our objectives. Dr. Southwell will be talking about some of the background and history with misinformation, talking about why misinformation is so compelling. And I think what we're all waiting for is what can be done about it. How do we start to address it in our communities? We'll be asking you to reflect a little bit about how it has impacted the work that you're doing with young people or the work through your prep programming. And we'll have some polls and chats for that as well. I should say before we get started, this is the first in a series of TA events that we're going to be bringing to you on the topic of misinformation. We will have another webinar in December thinking about misinformation and drilling down into specific audiences. And then we'll be having an opportunity to get together as a group and really think about how do we apply what we've been learning about misinformation to develop a plan or a strategy for how we're going to address it within our community. So I hope you're able to join us for one or both of those upcoming events as well, to really kind of start to come together as a group and think about how can we support each other as we grapple with this challenge. Thinking specifically about today, by the end of this webinar, we want you to be able to define misinformation and think about how it has impacted public health, describe 2 reasons why misinformation about your prep programming or about public health in general is easily spread through communities, and then to be able to identify 2 strategies that you can use to begin to address misinformation in your communities. So with that, we're going to start with 2 polling questions, and then I'm going to turn it over to Brian. So the first question is, have you ever encountered misinformation that has complicated your work? Go ahead and click either yes or no. We'll give you a couple more seconds. All right, I'm going to go ahead and end the poll, and you can see the results. So 94% of participants in this group have encountered misinformation that has complicated your work. And if you go to the next question, have you ever received formal training on handling misinformation? All right, so if you want to show the results are not quite as stark on this one, but it's still the overwhelming majority of us have not received formal training, despite the fact that almost all of us have encountered misinformation that has made our work more difficult. Thank you so much. I'm going to turn over to you, Brian.
Great. Thank you so much, Katie. And thank you all for being here today. I really appreciate it. I really respect and admire the work that you all do, and it's vital to the health of the country. And to have that work now complicated by the information environment that we face is an extra challenge. And so I appreciate the chance to be able to weigh in and offer some ideas. You all are not alone. In many ways, lots of different professionals demonstrate exactly the same pattern that you all just did of regularly encountering misinformation and yet not knowing what can be done about it. In fact, there's also worry and concern that some of the steps that we might take might actually make the problem worse, depending on how it is that we frame, what is the actual underlying problem that we face right now. And I think the real problem is both the prevalence of misinformation, but also the distraction from the really important messages that we need to share with people. So how is it that we can also simultaneously get people to pay attention to the credible and useful public health recommendations that we want to be able to offer them? So I really enjoy conversations like this, and I appreciate you taking the time. I recognize that we've got just an hour here together, so what we're hopefully going to be able to do is point the way to some ways of thinking about this, some ideas that are going to be provocative and hopefully useful, but this might start a larger conversation as well, where you'd be interested in talking further about this, and we'd be happy to do that. There's a larger conversation that's happening across public health professionals as we're thinking about some of these topics and ideas, and I'm happy to share what we know about all that. So I also really appreciate the wide geographic diversity that we've got here. I've been looking at where you all are located, and I appreciate the different backgrounds you all bring to the table. I hope that you can share some of that as we talk here together about some of the examples that you all are facing right now. So I am going to share my screen. What I wanted to do is offer some background and ideas about how it is that we got here. How is it that we're facing this moment of crisis, really, with regards to misinformation? So if you give me just a second, I'm going to go ahead and share my screen. And should hopefully see that. You can put in the chat if there are any concerns with seeing that. Otherwise, I think we could probably go ahead and move ahead. So we're in a fascinating moment where misinformation is very much in the headlines, actually, as a phenomenon, something that we are regularly seeing and talking about. In 2021, the U.S. Surgeon General's office went so far as to declare health misinformation a threat to public health and well-being. And that report, generated some news coverage and generated a number of responses from local county health and local and national health officials. But at the same time, while this was a spotlight, on the idea, we've also been dealing with health misinformation and misinformation more broadly as a concern for quite some time. And this really, in a lot of ways, is the culmination of at least a couple of years of concerted focus on this as a real threat to society. Back in 2018, the Washington Post actually nominated misinformation, as its word of the year. And it was not the only media outlet to do so. And some of that stemmed from observations of what was happening in the civic sphere and political communication. But nonetheless, people have been worried about this possibility for misinformation to complicate decision-making, for complicating public discourse, even prior to the pandemic, even prior to the Surgeon General's report of 2021. What's interesting about this topic, though, is that actually worry and concern about misinformation isn't particularly novel. It might seem that to be the case if you look at the headlines. It's certainly received, the actual word misinformation has received quite a bit of news coverage on its own recently, and that's probably something of a new phenomenon. But in terms of popular imagination, people have been worried about misinformation. They've been worried about the potential for new media, and what we might mean by new media has changed and shifted over time, but there's been worry and concern about new media being purveyors of misleading information for really decades and more than that. In fact, if you turn back the clock about a century or so, there is a turn of phrase which many of you will be familiar with as an insult that actually is rooted in a real incident. So if I were to call any one of you a snake oil salesman or a snake oil salesperson, you would be insulted by that, chances are. You'd know that I was saying something about your tendency to lie or to be fraudulent. But it actually turns out that this was rooted in a real historical series of events in which people fraudulently peddled and promoted snake oil liniment. In fact, this was part of the concern that led to our current regulatory structure in terms of advertising medical products. I appreciate Kelly noting here that this is a phrase that is popular in certain parts of the country in particular. And so really from early days of newspaper advertising, we've had concern about misinformation. In fact, of course, as long as humans have been able to talk to one another, they've had the capacity to deceive one another. And so there's been ethical worry about lying for as long as human beings have existed in societies. But even if we just look at the contemporary mass media landscape, if you fast forward ahead a couple of decades, there are a couple of examples that I think are really kind of eye-opening in terms of us having been here before. In the late 1930s, 1938, in fact, on a cool night like the East Coast will have this evening, actually in late October, there was a radio broadcast that was a dramatization of the H.G. Wells novel, War of the Worlds. But what was interesting about it was that Orson Welles and his Mercury Theater players had decided to put on this play and presented it in a way as a radio show that if you missed the introduction, as many people did because they were listening to another program, if you missed the short introduction, all you would have heard was what sounded like a radio variety show, which was periodically interrupted by news bulletins that suggested increasingly as it became clear that the state of New Jersey was being invaded by Martians. Now, I don't know if we have anybody on the line from New Jersey or New England or the Northeast, right now on the line, but so I won't comment as to whether or not that could possibly be plausibly true. I'm from New York originally, myself. Of course, it wasn't, and yet there was concern that people had been misled by this, and this was the first, really. Broad incident in which, or one of the first in which people were worried about radio as a new medium, as potentially a source of misleading information. Of course, this is at the same time when mass media are starting to be used as a source of propaganda, in Europe and elsewhere, and there's a lot of worry about this. At the same time, there's also a political cartoon that appears, which is prescient in lots of ways. If you look at the present moment, if you look in the top right part of your screen, you'll see a political cartoon where there's concern about officials being essentially misled into the problem of smallpox here, and that misinformation is responsible for that. The cliff that is depicted as that of misinformation as a dilemma. If you were to just substitute here, smallpox, if you were to substitute that out and add in, the word COVID-19, and maybe updated the fashion of the officials, here, that would look remarkably similar to what some people have worried about in the present moment. So we've actually been worried about misinformation misleading us from a public health standpoint for quite some time. So it's in the headlines. We know this is a problem. It's actually been something we've been thinking about for a while, but we've been particularly worried about it in recent years. Something that I want to point out is that there's a lot of academic literature that started to develop with regards to misinformation, and yet I worry that some of it is not necessarily going far enough in addressing the problem. A lot of what we're doing is simply pointing to the amount of misinformation that's out there, and that alone isn't necessarily enough to explain why it comes to pass, why this is persuasive for people, and it's also important, I think, for us to be careful of what's a tempting metaphor. People will often talk about misinformation going viral, for example, and I'm not sure that misinformation is exactly the same as a novel virus per se. There are ways in which it's analogous, but we also have to think about the vectors being slightly different and the nature of misinformation itself is being slightly different than say a virus that might be transmitted through the air. And so this led a couple of National Cancer Institute colleagues and I to work on an essay a few years ago in which we claimed that misinformation is actually misunderstood in a lot of ways as a challenge to public health. It's not to say that it's not an issue. It is, but the dimensions of it are ones that I think we need to explore. It's not the case that all pieces of misinformation that are out there are equally problematic. Some of them matter more than others. Some of them are possible to kill you, to lead to death, and other pieces of misinformation are more innocuous or mundane, for example. So I also think that the way that we're talking about misinformation, these days, runs the risk of doing harm itself in terms of the public discourse that we're offering. And what I mean by that is apparent, I think, in some of the recent news headlines that we might see, that we have seen. Here's an example of an NBC News headline, which is not unique. There are others like this out there, but in this particular headline, the claim is that Latinos are more likely to get, consume, and share online misinformation. And what is concerning about this is not necessarily the empirical association. It might be that certain demographic groups report a greater likelihood, but there's an implication here that somehow there's a causal link, per se, either in lots of different directions that might not be warranted by actual reality. So this headline like this, for example, might suggest that certain demographic groups are more vulnerable, inherently to misinformation, or perhaps somehow might prefer, misinformation. And I don't think we necessarily have the evidence for that, of course. And that's really important for us to, to keep in mind here as we think about trying to help particular groups, that might, through structural reasons, be facing information disparities. We have to be careful not to reify and to reinforce some stereotypical thinking, or to overlook what the true root causes of this information disparity might be. We see this similarly in discussion here during the pandemic. There were a lot of efforts to kind of quickly mobilize communities and to talk about different aspects of the pandemic. And here's one example where they documented in a Facebook live session with Anthony Fauci. There was a town forum, essentially, with the Navajo Nation and others, and there was a documentation here of the fact that in the chat there was some reference to misinformation, and that is a true observation. But I think we have to dig further to understand why it is that people might be referring to certain pieces of misinformation. What is it that was resonant about those elements of misinformation? What is it that was potentially useful in trying to make heads or tails of a confusing situation, rather than just necessarily pointing fingers at the mere presence of misinformation as the end of the story? So with that in mind, I think it's important for us to actually define misinformation. And some colleagues and I were recently invited to do this for a journal called the Annals of the American Academy of Political and Social Science. And I put the definition up on the screen, and I've broken it up in sort of an interesting way here, I think, just to really emphasize certain pieces of the definition. So we all would probably easily agree that what we're talking about when we talk about misinformation is misleading or deceptive information, that's publicly available. But there are a couple of other things we also thought were important to emphasize. First was that that scientific misinformation is information that's misleading relative to the best available evidence at the time. And the reason why we emphasize that is that science itself is iterative. Science itself, generates new ideas, over time. And I think it's really important for, various audiences to understand that science might generate a new set of recommendations, 6 months from now, based on new evidence. And if we don't put this in place in terms of the definition, we're going to rule out legitimate science, from 10 years ago or 15 years ago as being misinformation now presently. And I'm not sure that's really, useful. We've got to leave room for science itself to grow and evolve. And in fact, I think part of the remedy here is that we need better understanding of what scientific processes yields. And so that people can make heads or tails of the fact that sometimes the recommendations are going to change. And we've got to warn people of that in advance. And give them a sense that this is likely going to be happening. I think we probably could have done a better job of that during the pandemic. And then the second piece of this is, and this goes to the really front lines where you all are operating, is we have to recognize the social dimension of this problem, this dilemma. That what we're really talking about here, misinformation, sometimes it's willfully done. In the case of disinformation, as you'll sometimes hear, we're talking about explicit falsehood that people are spreading intentionally for their own gain. But misinformation is a broader category, suggests that sometimes this happens, inadvertently, but regardless, it's still a matter of actors who are operating outside the bounds of science and who are spreading, misinformation. And the reason I like to point this out is that there's a social aspect of this. What we're really talking about at the end of the day is not just the fact that there's misinformation you can find online. It's what you're really worried about often is that members of your community are listening to some source other than you. They're listening to some source other than you as a grantee. You've got information to share with them, and they're listening and paying attention to something else that they found online or something that their cousin heard. And so there's really a tug of war here and a bit of a social confrontation, and there's a bit of concern over what and who people are listening to. And I think part of the reason I'd like to emphasize that is that sometimes scientists and public officials will be up in arms about misinformation because people aren't listening to them. But this isn't necessarily a team sport. This isn't necessarily a matter of one side or the other being the arbiters of truth. It should be that we're trying to get people to pay attention to the best available evidence that's out there, and we should all be paying attention to what we have scientific evidence for, and not just to assume that one group necessarily is always right per se. And I think that if we start to take that stance, we can start to see this isn't about a matter of sides as to who you ought to be listening to, but rather really trying to encourage people to pay attention to the accumulation of evidence. So here, I want to pause just for a second because I imagine talking about this now, lots of examples are coming to mind for you. I'm really curious to know, what examples might come to mind for you in terms of the type of work that you specifically do. And so, if you could put just in the chat any example of misinformation that you've encountered, the 94% of you that said that you regularly encounter such misinformation. What's one example of that that we can look at here together? If we could put that in the chat. Yep. Okay, so we've certainly got here misperception. Carissa, thank you for getting the ball rolling. If others want to add to that. Okay. Great. These are all useful. Yep. Yeah. Okay. These are all good. I'll give you just maybe another minute or two. Yep. Thanks, Nancy. Yeah. Yeah. Okay, great. So why ask about these? It's not my intention here to then further spread misinformation, but I think it's important for us to look at this head on in terms of what are the misperceptions that are out there, what are the active pieces of misinformation people are encountering. And what I think is interesting about a list like this, right, is the ways in which each of these ideas, although blatantly false, nonetheless are things that you could imagine people being worried or concerned about, right? So part of what becomes interesting in thinking about what misinformation travels, what misinformation becomes prevalent, what misinformation spreads, is to put yourself in the mind of the audience that is both encountering this kind of information and potentially then the vector in terms of spreading it. Why would people be potentially concerned about some of these comments? There goes here to a deeper concern some people have about their sense of values, about their sense of threat to personal health or well-being, about different social dynamics and misperceptions, there that are nonetheless advantageous to certain groups, and as opposed to others. Again, what's important about this is to recognize that misinformation doesn't just spread magically because it's false somehow. It spreads because it speaks to certain things that people are concerned about. It offers an answer, or it offers a perspective, or it offers a simple explanation for a complicated, world. And that's, I think, important for us to keep in mind. And it's something that I want us to keep in mind here, sort of moving forward. You'll sometimes hear, the headline sense that false information travels further and faster than true information. And while there's some empirical evidence for that, I think that that type of framing actually itself is misleading, because I don't think that people are magically drawn to false information because it's false. The folks that put together and frame and craft false information have the advantage of being able to say whatever they want and to appeal to our human needs and desires, from the standpoint of in the same way that sensational information and tabloids do. And so that's something that I think is crucial, that misinformation doesn't just come out of nowhere, that it actually corresponds to and addresses audience needs and hopes and desires. And so the human element of this is going to be important for us to keep in mind moving forward. Okay, so let's ask ourselves then this question. Why is it that misinformation is compelling? What is it about misinformation that makes it a persistent problem for us to deal with? And I think there are at least 4 reasons that, for me, are the basis for a particular stance. That this slide both describes why misinformation is a concern, and it begins to describe why it is that, or how it is that we ought to address it. And I'll get to that in just a second. I want to point out a couple of observations, here from academic research in this area, and observations about the nature of our society, which I think if you can keep these in mind, this will inform any intervention that you as a group might decide to come up with. The first is based on cognitive psychology over hundreds of years. There's been a longstanding question about what happens when people encounter false information. And in fact, there's actually been a longstanding debate about this. It stems all the way back to a couple of philosophers that you might have heard of by the name of Spinoza and Descartes. And the short debate essentially is this: that from the Descartes' perspective, he thinks, well, we kind of know false information when we see it. We're able to kind of screen it out and move on to in search of true information. Spinoza says, well, we do have critical capacity to make sense of information as human beings, but that's actually not what happens at first. At first, we actually take in information at face value. In fact, we have to do that in order to make sense of it. So we actually take it in, and then we make sense of it as being false or true in a second step, which might sound like a subtle difference, but it makes all the difference in my mind, because if you think about a landscape where people have access to tools that allow them to, for example, with a click of a button, share a piece of information or misinformation with 1,000 of their closest friends, well, then it matters if we have a tendency to take in information initially as being true and then later make sense of it as being false or not. So if it is the case that we have this capacity, but it's in a different part of our brains, it means that we have to be motivated. It means that we have to not be fatigued. It means that we have to not be distracted by the million things going on in our household as we're trying to put dinner on the table and pay attention to other things that happen during our day. And so I think what often happens is that people quickly spread misinformation before they've had a chance to really process it. And unfortunately, modern communication technologies make that possible to happen really quickly. And so if any of you have ever been in the position of having posted something on a social media platform and then later had to apologize for it being not accurate, you can imagine how often that must happen. And I think that's part of what we see. I don't think it's a matter of people always willfully and earnestly sharing false information. I think that sometimes they're doing so for other reasons. And so this leads to the second point, which is that as social beings, we as humans are a crucial vector for the spread of misinformation. The problem really is us, in partly. Yes, there are originating sources of false information that you can find on the internet and other places, but part of the reason why misinformation reaches levels of prominence is that it spreads from person to person as well. And what I would like to point out about that is that as social beings, we aren't necessarily always just interested in the truth per se, or in facts per se. We talk to people for a variety of reasons beyond just simply sharing truth. And a good example of this is something that, fortunately, I can now raise again as an example. For a couple of years, it was an example that was only in our memories. But imagine getting onto an elevator, in a building, and you see somebody else that get on that elevator, and you talk to them about the weather. Well, in that situation, you both were just outside, so you're not sharing any new information about the weather, but you nonetheless are deciding to talk to that person. Well, why would you do that? Well, partly what we think is happening is that people often will open their mouths and bother communicating with one another because they want to signal that you're part of my community. They want to acknowledge you as part of my tribe, or part of my network, or part of my community, and I want to be civil to you. Or I suppose the alternative is that you can just look down at your phone and not acknowledge that person. But this nonetheless is something that I think is really important to keep in mind. And I think the same kind of thing is happening when people share sensational misinformation. Sometimes they're just sharing gossip in ways that isn't always exactly about the facthood of it. Third, I think it's really important for us to keep in mind that in a country like the United States, we have a regulatory regime which is importantly not defined by censorship. And I think that's a good and important thing. But what it means is that, generally speaking, we have an open system where we do have regulatory authorities that can and do sometimes act on bad pieces of information that are out there. But even if you look at, like, for example, what the Food and Drug Administration does with regards to false claims in prescription drug ads, they have what we might look at as a post hoc system of detection. They are looking at content that's already out there, and they're then asking for remedy or redress of that. What they're not doing is sitting around in a room saying, well, this advertisement can go on air and this one can't, or this can go on the internet and this can't. Essentially, it's possible for misinformation to leak onto especially the internet, but even airwaves. And sometimes it can exist for a while before it's addressed and taken down, or addressed with a corrective advertising campaign. So we've got to live with this reality of misinformation because of the nature of our environment. And I don't think we'd want it to be any different, right? If we had a situation of censorship, that might allow more control, but then who is it that's holding those reins? That's a really important question, and a lot of First Amendment scholars would be concerned about that. The last thing I want to note here is that it is possible to correct misperceptions. So even the misperceptions that you all are encountering, I want to suggest you can counter them. You can correct them. But we also know, based on literature, that that's not the easiest thing to do. You actually have to be pretty explicit in calling out a piece of information or a misperception that you want to correct. You've got to be explicit in correcting it. And you've got to do so in a way that essentially uses the same level of exposure as the original piece of misinformation had. So if you've got a Super Bowl advertisement that is misleading, and then you attempt to correct that with a carefully worded post on your internet site somewhere, that's not really meaning fire with fire. It's important for us to spend time and resources, and so that means that doing the work of correction is going to be expensive, sometimes. And so I want to point that out here. So all these are reasons why misinformation is not going anywhere, but we can take some steps to actually address it. So I'm going to just quickly walk through a couple of those points here then. If we take for granted the evidence that Spinoza was actually right, and what we do in encountering false information, we've got to then develop a stance where we realize we all are in this together, and that we all are vulnerable to misinformation. For me, that's the single biggest revelation here, is that actually it's not a matter of being a member of a certain demographic group or other ways we might characterize differences in people, that actually all of us as human beings, under the right circumstances, are vulnerable to misinformation, period. And as a result of that, that's actually a very unifying concept, because it suggests that we all ought to offer some grace, and we ought to be empathetic to our audiences, to the people that we're trying to work with. And so for me, if there's one takeaway you have out of the talk like this, it's that the basis for your misinformation intervention, the basis for what you ought to do in addressing misinformation is to start with being empathetic for the audiences that you want to work with and for the people that you're trying to serve, because we all could be in a situation of being misled. I think it's also important for us to develop interventions that realize that people don't operate in a situation of complete calm all the time, that emotion is part of our humanity in a good way, but emotions also complicate our information processing. We know that there's a lot of good work that suggests that emotion, like anger, can lower the bar for us. A former graduate student of mine, Brian Weeks, did some work that suggested, in fact, that anger actually encouraged the acceptance of inaccurate information. You can imagine what implications that has for the political environment, but it also has important implications for public health. And we certainly are in lots of situations, certainly the work that you're talking about in terms of sex education, you're talking about an arena that is filled with emotion, in which people are often, really in an emotional state and debating and talking about these issues. So that's going to likely affect, their vulnerability, here to misinformation. I also like to point out that, again, and thinking about us being part of the dilemma, there are lots of examples of people that have made a living on misinformation, and we can point the finger at them ethically, as being fraudulent. But I actually want to point out that we are part of the issue and the dilemma. A good example of this is a woman by the name of Belle Gibson. Belle Gibson was a social media influencer in Australia who rose to fame, or rather infamy, on the basis of her building a large network of followers regarding her claims about how to overcome cancer. She would tell these stories about having overcome cancer through various diets and nutritional means. And it turns out, unfortunately, that Belle Gibson never had cancer. And a lot of what she was saying was fraudulent. And so we could be worried about that and blame Belle Gibson. But the truth is that nonetheless, Belle Gibson actually found followers. She found an audience. And so the question for us is whether or not our own vulnerabilities here are really what we have to be focusing on. We just talked about the fact that we need social connection, but I also think that as human beings, we need hope for the future. And if misinformation offers hope, and our counter messages, or what we're trying to offer, doesn't offer hope, or is less or more pessimistic, you can think there's an imbalance. And people are going to be gravitating towards the information that provides them hope, the information that provides them a sense of life as they want it to be, information that allows them to be in denial about certain realities. And so, the deck is stacked. And that's just the reality here, that misinformation in situations where people are hopeless, where they're alienated, where they need social connection, misinformation is often going to gain some traction. So this leads us then, and the last part of what I want to talk about, to the question of what we might do about this. And I'm wondering here in the chat if you could also put in, and thanks, Kelly, for your comments here too, just a couple of thoughts about why it is that you've actually not been able to successfully address misinformation in your community. What have been some of the stumbling blocks that you've run into? What are some of the reasons why, when you've attempted to overcome misinformation, you feel like you haven't been successful? What's gone wrong as you've tried to do something about this? You can put just a little bit of that in the chat, and we'll just take a quick look at that. Okay, so we've got here worry about emotions, worry about state agency and politics, strong personal values. Okay, so it's going to complicate, and it's going to be reasons why people may not necessarily want a fact-based argument as a counter to their deeply held concern and belief. Emotions and how to say it correctly. Okay. Good. People who believe misinformation is larger than people who don't in a certain area. So you're going against grain. So we've got social norms here. Okay. Again, the social dimension being really important. Systems of power. Okay, Maisie, thank you for that. So this is hard work, right? So how the heck are we going to address all this? And I'm sure there's a lot more that you all have here too. So feel free to keep putting this in the chat. what I want to suggest here in terms of what we can do is that there are some steps that we can take. There is an increasingly robust academic literature on this, where we've started to ask questions about, why does misinformation spread, but also how can we stop it? How can we mitigate effects? How can we stop people from sharing misinformation, even if we can't stop people from posting it online? There's things that could happen at a policy level. There's things that could happen at the level of social media platforms in terms of, offering some friction, as it's sometimes referred to, and slowing down how quickly people can share misinformation. But there also are steps that you all as grantees can take. And this is something that I think can inform, community level engagement here in really important ways. So recently, some colleagues and I took on the question of misinformation as potentially a source of health disparities. And thanks, Sharon. And we got some good ideas coming in here already. And what we ended up, we were asked and charged with the question of whether or not misinformation is actually responsible for the health disparities we see. And we actually turned that question around and said, I'm not sure that's a particularly fair question. While it is true that some people that suffer, from health disparities are also people that are likely to have, be exposed to misinformation, we don't think the causal order runs in the direction that's implied by that question. And instead, we thought, really the solution here is really grounded in making an assumption that people want to keep themselves and their families healthy, that they are open to good and useful information, and that we probably need to do a better job of lifting up that information and in building relationships of trust so that people are paying attention to the information we have to share with them, rather than other sources of misinformation that they might be turning to for other reasons. And so that's we can come back to that idea here in just a minute, but the short takeaway is that we've got to focus a lot more on building trust and a lot less on blaming those who don't trust us. And that might sound like a simple idea, but actually think about how often in your meeting that you might have with colleagues where you're like, well, this is out there, what are we going to do about it? How often are you talking disparagingly about the people that actually believe this? How often are you thinking that what they're thinking is ludicrous or ridiculous, and you're frustrated that they're getting in your way here? And that stance itself is one that we've got to think about here. Well, how can we instead approach this from a situation of empathy? Lots of great things coming in the chat. We'll come to that here in our Q&A here at the end. But as a sort of nutshell for ideas, and I'm going to give you just a couple of examples in other sectors, I think what we've got to do is do a better job of encouraging compassion. We've got to do a better job of really providing resources for the translation of scientific evidence. And I mean this not just linguistically and culturally, but also just in terms of unpacking and providing people insight into peer-reviewed academic literature that otherwise might be more difficult for them to discern if they don't necessarily have background and training. We just take that for granted. We've got to spend more time from a workforce perspective in actually having a formal, science communication professionals and translators operating at local levels. I think that's really crucial. We've got to do a better job of actually finding out what people are encountering out there in the world. This might mean holding our nose and looking at what is happening in a community. What are the top things that are trending on Google? What's happening in terms of rumors circulating in your local area? And this is something that you, as folks operating in a nonprofit, operating in a local county health department, may not personally believe, you might be really offended at, but nonetheless, this is what people are being exposed to. So we've got to do a better job of setting up monitoring systems to find out what's circulating, just like we do with diseases. We've got to do the same thing with misinformation. So we've got to know what it looks like in terms of the community spread in a particular area of particular ideas. And I think that we can do a better job of that than we've done to date. And then lastly, I mean, we do need to count on people to become better seekers of information. I don't think what you don't see on this list is any effort to vanquish misinformation from the information environment. I just don't think it's possible. I think that if we try to do that, we're going to be, it's a fool's errand. I think instead what we've got to do is try to empower people to seek out good sources of information and to pay attention to those. And I do actually think that we see lots of examples of instances where people actually do that. Again, assuming that people are driven by the motivation of keeping themselves and their families healthy, which I fundamentally believe that most people want to do. So we've had this come up in a number of instances where I've been asked to consult on different projects. One example of this was a couple of years ago before the pandemic. I was asked to consult with the European network of science museum professionals. It goes by the acronym XSite. And they were really up in arms about this notion of misinformation. They wanted me to come over and talk about how we could go to war with those that were spreading misinformation. How could we combat misinformation? And my biggest recommendation was for us to drop the war metaphor. Was to actually take a step back and to think about what we're doing is not being, just fact checking and vanquishing, but instead thinking about how how science museums can be hubs of community dialogue and conversation, where we can raise up and have questions about, legitimately what values people hold, and then point to credible information, there, and that's, I think, a stance that they ended up embracing. We ended up changing the name of the workshop, from combating misinformation to beyond fact checking. Is just one minor example. We've taken a number of steps to organize efforts at RTI on this. We, together with the Rita Allen Foundation and the Aspen Institute, organized a forum. We put a white paper out on different ideas people could use to address the spread of misinformation. And we've got that available as a white paper through RTI Press. There are lots of different tactics that people suggested, not the least of which were media literacy efforts for local populations, for students and for others, and also different tools that people could use to help dispel misinformation in their own social networks. We've organized efforts on trust in science and how to build and maintain trust in science with nonprofits and local foundation or with foundation leaders. And again, I think there's some similar themes here. We've got to do the best we can to open up the doors of science, to make sure that people understand how science operates, if we want to instill trust in science. And we do have to depend on audiences, to become more critical in their inquiry and search. But we've also got to train our scientists and our public health officials and our leaders to become better communicators. And we also have to really encourage collaboration. So I'd love to see, when I always love talking with networks like this one, about how it is that we could all work together on this, because not all of us have all the tools that are necessarily going to help address all this. So ultimately, there are a few additional thoughts I just want to leave you with as you're thinking about what we might do. I'm going to suggest that we need to better build trust, but for me to say that, I think it's important for me to point out that not everybody thinks about trust the same way. We might think about trust in terms of intellectual credibility, how smart a person is, whether or not they have all the answers. But people also, as we see this in the empirical literature, people think about trust in terms of consistency, in terms of reliability, but they also tend to think about trust in terms of shared interests. To what extent do you care about whether I live or die? And if you don't think that an institution or a spokesperson does care about whether you live or die, then you're not necessarily going to trust them in the same way, regardless of how smart you think they are. So I think part of what we need to do here is to think about how we can better identify what our shared interests are between your grantee organizations and the communities that you're serving, and how to spotlight and uplift those shared interests. How is it that we can point out to people the reasons why you actually care about their various behaviors, why you care what they understand, in terms of all the material that you're trying to offer them. And so we can think about that. That's I think an opportunity for us to reflect on that question, here individually, and maybe start to have some ideas that you can put in the chat, here as well. What is it that we could do to first point out why people should listen to us, as opposed to starting with some of the facts that we're trying to offer them? What is it we could do to actually signal the shared interests that we actually hold? That's our starting place. And what that means is that it's going to take a little while, right? But we should be planning now for the misinformation mitigation efforts we want to be engaged in 6 months from now or a year from now. Now is the time to be building the relationships with people that will be the basis for our later engagement. Rather than trying to rush in when there is a crisis and we're trying to put out a fire, we need to have built up that relationship to begin with. So we can think then here about specifically healthcare and public health professionals. I think a lot of these lessons, very much apply, and can be drawn in, but there also are some specific ideas that I want to point out. And these are ones that are related to a program that we've developed at Duke University. A couple of years ago, we did a survey of licensed medical practitioners, and it was eerie how similarly their patterns actually reflected exactly what you put in the chat. It was about 94% or so, about 95% of people said they regularly encountered misinformation amongst patients. When we asked people about how regularly they had been trained, in their case, it was around 18%, just under a fifth of people had said they'd received any kind of training as to what to do about misinformation. So in light of that, we actually have developed this program on medical misinformation, which offers workshops that are essentially, an opportunity to think about, taking a stance of empathy, walking through, having crucial conversations, with patients, about what their values are, about why misinformation that they were attracted to, why it was important to them, not accepting it as being true or false, but asking why it was that they're paying attention to that. And I think that stance interpersonally is one that can be extrapolated to the broader community approach that you all are taking. What are you doing to actually ask questions of your audience, why it is that they're paying attention to the misinformation they're encountering, what are they encountering, and then what can you do to gently invite them to credible sources of information that speak to their values, not just credible sources of information that debunk misinformation for the sake of it, but information that's actually useful to people. So if you find that most of the misinformation people are drawn to has to do with particular fears about what their kids are going to get into, then you make sure that the credible pieces of information that you're offering speak to those fears, speak to the values that they're trying to express in terms of family dynamics, and don't necessarily just debunk for the sake of debunking. This isn't necessarily a factual argument that we have to win as much as to have a conversation with audiences. So we actually have some resources available that I wanted to raise here that we could share with you. There's a 8-9 minute video that some of you might find useful. If you follow up with me later, I could share that with you as a public resource. But ultimately, I know we wanted to pause and offer just a few minutes here, for you to reflect on, what strategies that you might now use, out of this initial stance. But I also want to, and thanks, Katie, for putting a couple things in the chat there directly. I really appreciate that. I'm going to pause here and stop my sharing so that I can see you all and see the chat a little bit more directly. I'm happy to entertain a little bit of a conversation with observations and questions you might have. Feel free to reflect on what here might be useful or what seems to resonate with what you're already doing. So either put that in the chat, or if you've got questions, feel free to raise them, and I'm happy to answer questions about anything that I raised. But I know it's a lot of material in an hour, but there's a lot to introduce here, and I'm happy to have this be the beginning of a larger conversation. So thank you.
Brian, I have a question.
Yeah, Chris. Yeah.
So sometimes in some of our trainings, we are directly asked questions that would be perhaps misinformation.
Yeah.
And I know in a lot of my recent trainings, they talk about not verbally repeating the misinformation as you kind of break it apart. So targeting the key pieces that you can both agree on and relate to, and kind of, touching in on those emotion pieces. I mean, do you agree that that's something that you should avoid?
Yeah, well, it's interesting because in the correction literature, there's this worry and concern about, whether or not you're essentially in explicitly correcting something. Sometimes you're introducing the misinformation to audiences that haven't heard it before. And sometimes what you're doing, if somebody doesn't buy what you're doing in terms of the correction, you're reinforcing that misperception with them. So it seems like a whole lot of damage you're potentially doing. And I think that some of that potential's there. I think some of the literature overstates how much that happens, because some of it's based in the political arena where some of these ideas are really deeply embedded in values. But nonetheless, what I would recommend here is we learn lessons from the so-called inoculation literature. It would suggest that, generally speaking, if you just blatantly lead with repeating something that's really outlandish and really sensational, that's going to burn in people's memory, and there might be attention focused on that. But can you frame your conversation first in terms of letting them know that here's what we know. Here's how I'm going to take this and address part of what you said. But what I want to start with, what I want to lead with is essentially inoculation against the fact that I'm going to gently correct part of what you're saying. So not to even say, well, that's an interesting idea, but rather, what we do know is X or Y. This speaks to, some of the concerns people have raised. I'm going to tell you a story about how, some people have raised some of these ideas which turn out to be false, but really trying to emphasize what it is you have to say positively and proactively about that. So it's a little bit of a nuanced approach to it, but if you're in a wider forum where there's a Q&A, it's sort of tough because the kind of the person's already said it, and it's out there. It's like I used to teach regularly over my career, taught courses with a few hundred people, and sometimes you open the floor and somebody says something that's really offensive. Occasionally, like, well, shoot, now you've said it and everybody's heard that. What do I need to do as a speaker? Kind of quickly, correct that, but also acknowledge that I didn't necessarily endorse what you just said, per se. So it's tricky. I would say that the key is really trying to emphasize what it is that you want people to believe, rather than spending a lot of time belaboring what you don't want them to believe, if that makes sense. And really trying to point to information that might speak to the underlying reason why they've raised it. So in the misinformation workshop training, one of the things we suggest is not to spend a lot of time going toe to toe with particular falsehoods, but rather to ask the question, why are you raising that? What is it about that speaks to you? What's important about that? And sometimes you'll get a hint as to what the underlying worry or concern or value is that other people are raising. So it's a difficult position to be in. This isn't easy work. So I appreciate that, Carissa. Yeah. Okay. We've got a comment here from Sharon. And I'm going to just look at this quick. Along with understanding how to address misinformation, public health groups and their partners need training on basic marketing strategies, how to be effective in promoting positive, accurate information in clear and simple conversational ways. We need talking points and sound bites. Yes, Sharon, I would agree with that wholeheartedly. What might sound like straightforward, simple observation is actually surprisingly crucial. Part of what we need to do is do a better job of getting our information out there in the first place. And that's, one of the things that I've worked on a number of different, parts of this problem. And I think some of the social media platforms are realizing that part of what they can do is to put a better spotlight on credible information, and to not necessarily always worry about just debunking, what else is out there. And I think that's part of what we need to do too. And we have to realize that unfortunately, the promotion of certain ideas is hard work simply in terms of getting the exposure that you need. And so sometimes it's a matter of thinking mechanically about how, we've got this beautiful brochure that's carefully worded, that's passed all levels of review internally, but 17 people have seen it. And a lot of people have seen this social media post. So it's just not an equal balance there. And so what could be done? I'd rather sometimes that, grantee organizations spend time with their basic information, just trying to get it out to as many people as possible, rather than necessarily spending so much time with the nuances of a particular turn of phrase or a word here or there. As important as that is, I'm all for thinking about messaging and framing, but sometimes people overlook the simple step of, simply actually addressing and getting it out to people, and making sure that people know that you are a source of information that is just as willing to talk to them as what they find on Google and on their phone. Because part of the reason people are turning to some of this information is because it's so convenient. It's what's available to them. How can you get your information to be just as available to people and prevalent as what's available to them on their smartphone, right? Okay, Sharon, I really appreciate that. So Heidi's got a question about the recording being posted. I'm going to turn to Katie here and see what's possible. I know she's got a survey, I think, that she wants you to address. I know we've got 2 minutes here to kind of wrap up. So thanks so much, Lisa. I really appreciate your stance. I think is really great too. Katie, what else do people need to know here in wrapping up, and what can they do if they want to share some of this with colleagues? Are we going to have a recording, or what's the situation?
I'm going to let Kanika take it. Go ahead, Kanika.
Great. Hi, Kanika. Yep.
Thank you so much, Brian. This was so much great information. Hope everyone has something that they can take away. So this is recorded, and I do believe it will be uploaded to the exchange. Is that correct, Katie? Yes. And so we just want to say thank you. We have a thank you email that will go out along with some resources that are listed here. And so we will make sure that we also include the links that Katie dropped in the chat. So if you would please grab your go down one more slide for me, Katie. Thank you. Grab your cell phone real quick, and you can scan this QR code and do the evaluation, or you can use the link that Katie dropped in the chat. I'll do it one more time just so that you have it. If you would please share this link with others on your team and make sure that each individual completes this evaluation separately so that we will have this and we can make sure that we use it to shape and inform and improve future webinars. Thank you so much. Do we have any additional questions for Brian? Last minute? Yes, we'll get that recorded and out as soon as possible. Thank you so much, everyone. Have a great day.